Hello guys, so now we shall be discussing regarding the anatomy of the temporal bone. Okay, so regarding the anatomy of the temporal bone, few important things you need to understand. For example, so this entire part which is highlighted with the green is called as your temporal bone. Now I am removing or I am separating the temporal bone from the rest of the parts, okay, and then I am putting out here. But before that, before I put it down here, you just have to look here what are the bones that are in additionally attached to this temporal bone. For example, you see temporal bone is attached to this bone over here called as parietal bone, right? It is also attached here with the occipital bone. So this is your occipital bone, and it is also attached with this particular bone over here called as your sphenoid bone, right? So these are the structures to which the temporal bone is attached. Now if after removing this temporal bone, this temporal bone itself has got many parts. The largest part which you can see over here, this is called as the squamous part of the temporal bone. Okay, so this is called as the squamous part of your temporal bone. After that, this part which you can see over here is called as the zygomatic process. Zygomatic process of the temporal bone. This green color part has got an opening. You see, this opening is called as auditory meatus. So this green bone is surrounding that auditory meatus. You see an opening over here. So it is surrounding this auditory meatus, and you call this as a tympanic part. Tympanic part of your temporal bone. Next, here attached to this tympanic part, you see a process that is coming down. This is called as a styloid process. Styloid process, and the back one you have got here, this is called as a petromastoid bone. Petromastoid bone. So what are the different bones that are forming the temporal bone? First important bone is your squamous, next petromastoid, third is a styloid process, fourth is a tympanic, and fifth is your zygomatic process, right? So these are the different parts. Now first we shall discuss about your squamous part. Okay, so first our discussion would be regarding the squamous part of your temporal bone. Now first important thing regarding the squamous part, the first statement which you have to give is that out of all, the squamous part is the largest part of your temporal bone. So this is your largest part of temporal bone. So this is the largest part of your temporal bone. Second important thing is that if you look at this, this is looking like a plate, right? And this squamous part is the one which is located on top of all the parts. Yes or no? If I'm drawing a line, so squamous part is the one which is located on the top, and bone number 2, 3, 4 and 5 are located below it. So it is a plate like flat bone located superiorly. Okay, next important thing, third important thing is that if you look at the temporal bone, right, if you look at this temporal bone, this is the temporal bone. Okay, so this part of the temporal bone, whatever you can see, right, so this is a little bit convex in shape, right? So this convexity here is forming a fossa. You see a fossa over here, so this fossa over here is called as the temporal fossa. Okay, so the outfacing surface of squamous bone, outfacing surface of squamous bone is convex, forming temporal fossa. Forming which fossa over here? It is forming your temporal fossa, right? Now important thing is that anteriorly where does it articulate and posteriorly where does it articulate? Look at this picture over here, right? So in this particular picture, this is temporal bone. Anteriorly it is articulating with this particular bone over here, and this bone is called as your sphenoid bone. Posteriorly it is articulating with another bone over here, right? So this particular bone is called as your parietal bone. Okay, so anteriorly it is having what bone? It is having sphenoid bone, and Posteriorly, it is having your parietal bone. So anteriorly is the sphenoid and posteriorly it is articulating with the parietal bone. Okay, right. So this is all the important things which you need to know regarding the squamous part. And second important thing we shall discuss is regarding the zygomatic process. Zygomatic process. Now regarding this zygomatic process, where is this zygomatic process present? So a zygomatic process is present in the lower part of the temporal bone. It is arising lower to what? It is arising lower to the squamous bone. Okay. So zygomatic process arises from lower part of temporal bone. Lower part of temporal bone. First important. Second important thing, this zygomatic process is also called as your cheekbones. They are also called as your cheekbones. And third important thing is that to this zygomatic process, which muscle is attached? Masseter muscle is attached. So masseter muscle attaches here. Masseter muscle attaches here. Okay. Now after the zygomatic process, the next important bone we shall be discussing is the tympanic bone. Okay. Now where is this tympanic bone? Just look at this. Where is this tympanic bone? This particular tympanic bone is located below the zygomatic process, I mean below the squamous part, right? Below the squamous part and in front of the petromastoid part. So this one over here is your petromastoid, this one over here is your squamous. This is your squamous and this is your petromastoid. Now tell me, in front of petromastoid what do you have? In front of petromastoid, this green color bone what do you have is your tympanic bone. And I can also tell that it is located below the squamous bone. So tympanic part lies inferior to squamous and anterior to petromastoid part. Anterior to petromastoid part. Okay, so this is your tympanic part. This particular tympanic part over here is encircling what? This particular tympanic bone, whatever you can see, you see it is encircling an opening here, right? So this opening will lead into external auditory meatus. And by the way, this opening is called as external auditory opening. If you are putting a finger into that, that will lead into what? External auditory meatus. For example, this is called as external auditory opening and this part over here is called as external auditory meatus. Okay, so this is your external auditory opening and this one is called as external auditory meatus. Okay, and where is your bone present over here? Your bone is present surrounding this. So this is the petrous part, this is the tympanic part. You see the tympanic part is completely surrounding this region. So this is the tympanic part which is completely surrounding it. Okay. So this is all you need to know regarding the tympanic part, and the next important part is the styloid part. So the next important process is the styloid process. Now when it comes to the styloid process, important thing you need to know that this styloid process is responsible for the attachment of stylomandibular ligament. So this is the attachment point for stylomandibular ligament. Okay. For example, let us say that this is your temporal bone and this temporal bone down here it is having the styloid process. Okay. Let us say that this is the zygomatic process. And you also know one very important thing that here let us say you have got your mandible like this. Just a rough picture. This is your mandible. So from the styloid process all the way to the mandible, if there is a ligament like this ligament is called as stylomandibular ligament. And the last part after the styloid process we have to discuss is your petromastoid part. So this part over here is your petromastoid part. Now why are you calling it as petromastoid? Because it is having two parts. One is called as the petrous part, another one it is called as a mastoid part. Another one is called as a mastoid part. So there are two parts, one is called as a petrous part, other one is called as a mastoid part. Now when it comes to the mastoid part, what is mastoid part here? See, this entire bone which you can see, is called as your petromastoid. This entire bone which you can see is your petromastoid. Now if I am dividing this petromastoid, this inferior projection whatever you can see is called as a mastoid part. So what is your mastoid part over here? Mastoid part is nothing but the inferior projection of the bone. Inferior projection of the bone. Now within this mastoid part, what do you have? If you look here very closely, within this mastoid part you have got some air cells, right? See, within this mastoid part, what do you have got? You have got some air cells. So these air cells are called as mastoid air cells. Mastoid air cells. Now what is the use of this mastoid air cells? All of you know that from the nose till the middle ear you have got a tube called as auditory tube that is attached. Why do we need an auditory tube? To equalize the pressure in the middle ear. For example, you are in a flight, right? So the pressure differences outside and within your middle ear are not equal, right? Within the cabin in comparison with the middle ear are not equal, obviously at higher altitudes. So what you do, you basically chew a chewing gum. So when you are chewing a chewing gum, what will happen? The air which is present outside will go down into the mouth, from there through the pharyngotympanic tube to the middle ear, and so the outer compartment and the middle ear compartment air will be completely of equal pressure. So that is called as a concept of equalizing the pressure in the middle ear. So if pharyngotympanic tube is blocked or if it is dysfunctional, so in that case which will act as equalizing the pressure, that is your mastoid air cells. So mastoid air cells is responsible to cause equalizing the pressure in the middle ear, equalizing the middle ear pressure, right? And what about this petrous part? So this part which you can see, right, this part which you can see is called as petrous parts. If you are drilling hole into this petrous part, you are going to meet the inner ear. Okay, so petrous part, so this petrous part contains what? This petrous part contains your inner ear. So what are the muscle attachments which you can see over here? So the muscle attachments over here are, the first important muscle which you need to know is the temporalis muscle. Okay, and the second important muscle over here is the masseter muscle. So all these are the muscles which I am writing right now are attached to your temporal bone. After temporalis, masseter, the third important muscle is your sternocleidomastoid muscle. Sternocleidomastoid muscle. After sternocleidomastoid muscle, the fourth important muscle you have is the posterior belly of digastric. Posterior belly of digastric muscle. Posterior belly of digastric muscle. And the fifth important muscle over here is your splenium capitis. Splenium capitis. Okay, so this is the fifth important muscle. Now, next important thing is that where is this temporalis attached? Temporalis is attached to the lower part of the squamous bone. Okay, it is attached to the lower part of your squamous bone. Now, after this, where is this masseter attached? This masseter is attached to the lateral zygomatic surface. It is attached to the lateral zygomatic surface. And next important thing, where is this sternocleidomastoid attached? The name itself says mastoid, so it is attached to the mastoid process. Mastoid process. Not only that, even your posterior belly of digastric and splenium capitis is also attached to the mastoid process. Okay. So these are all some of the important things which you need to know regarding the temporal bone, guys. So thank you so much for watching my video. Goodbye.